Bipolar disorder. The colloquial term bipolar, meaning very moody, should not be confused with the clinical diagnosis bipolar disorder described on page 123 of the DSM-5. Formerly known as manic depression, bipolar disorder is a serious mental illness that causes an individual to have radical shifts in mood, emotions, and energy levels, transitioning from extreme lows to extreme highs. These shifts usually do not occur over the course of a few hours. Rather, they generally happen over several days or several weeks. To distinguish bipolar disorder from other mental illnesses, we will look at 4 mental disorders that share some common features. Unipolar depression, also known as major depressive disorder, bipolar 1, bipolar 2, and cyclothymia, which is also called cyclothymic disorder. The low moods that people with bipolar disorder experience are the same as those in major depressive disorder, also known as unipolar depression. When undergoing a depressive episode, individuals suffering from major depressive disorder feel a lack of energy, a loss of mental focus. They feel hopeless and despairing. Physical symptoms of this disorder include eating and sleeping too much, or conversely, eating and sleeping too little. Mania or manic episodes are the distinguishing feature that separates bipolar disorder from unipolar depression. Individuals who have been diagnosed with bipolar disorder frequently describe feeling on top of the world, full of energy, almost superhuman during their manic episodes. These highs may sound appealing, but when someone is in the throes of a manic episode, they can make unwise, even disastrous financial investments, or sign on to a risky business venture that they know nothing about. They might even become physically reckless. Making poor decisions without concern for future consequences is a hallmark of these episodes. Diagnosing and treating this disorder is crucial because when people are experiencing mania, they can harm themselves and others. Physical signs associated with manic episodes include high speed, nearly constant talking. Sometimes the person keeps moving restlessly, as if they are driven by a motor. When describing how they feel, they might report that they feel really wired or that their minds are racing from one thought to another. These upswings can also include delusions of grandeur, and people with bipolar disorder, when they are in a manic episode, might declare that they are capable of composing a symphony, despite not being able to read music, or ready to lead our nation, even though they have no experience in politics. Bipolar 1 is characterized by dramatic lows that last at least 2 weeks, and some dramatic highs that last at least a week or require hospitalization. Untreated manic episodes can last for 3 to 6 months. An important fact to keep in mind about bipolar 1 is that even though depression arises in most cases, it is not required for a diagnosis. It bears repeating that mania is the distinguishing trait of bipolar disorder. Bipolar 2, which occurs when a person has lows similar to those in bipolar 1 disorder, but the highs they experience are less intense and are called hypomania. To receive a diagnosis of bipolar 2, an individual must have hypomania that lasts for at least 4 days. But in general, their symptoms last for anywhere from a few weeks to a few months. The final mood disorder that we will take a look at is cyclothymia, which resembles bipolar 2 in that the mountains and the valleys of the person's mood shifts are less dramatic than the extremes people with bipolar 1 experience. To be diagnosed with cyclothymia, An individual must cycle back between these highs and these lows for at least 2 years. Additional possible symptoms associated with these mood disorders are mixed episodes and rapid cycling. People with bipolar disorder who are having mixed episodes experience bouts of depression and mania that occur at the same time. Rapid cycling occurs when someone has 4 or more episodes of depression or mania within a given year. What causes bipolar disorder? No single gene has yet been linked to bipolar disorder, but a clue that's important to look at is that people with close family members who have been diagnosed with BP are 10 times more likely to be diagnosed with the disorder themselves. Some drugs can trigger manic episodes, and these drugs include serotonin reuptake inhibitors, or SSRIs. As this training explores a range of diagnoses, it's important to note that people who have bipolar disorder often have other disorders as well. Common comorbid disorders include anxiety disorders, ADHD, substance use disorders, personality disorders, making both diagnosis and treatment extremely challenging. So, what's the value of a diagnosis? Well, there is no cure for bipolar disorder. Diagnosing and treating this condition is crucial because there is real danger that people with this disorder can harm themselves and others during the manic or even the depressive phases. Mood-stabilizing drugs such as Lamictal and lithium salts can reduce the intensity of the manic episodes. Some other treatment options can have side effects, and these effects can drive people to stop taking their medications, which in turn can endanger that person or other people. Unfortunately, talk therapy and cognitive behavioral therapy have not proven to be effective treatments for the manic episodes associated with bipolar disorders. That said, these treatment modalities can help individuals after a manic episode has run its course. Therapy can also help the person learn stress management techniques that might help them avoid a manic episode in the future. Please take a moment to complete the electronic knowledge checks that test your recall of the information contained in this short video.